Let's talk about how you accommodate for strength when using the foot holder. So first of all, the foot holder lies in between your rails. You just pull it up into position. So you're going to have someone, if they have long enough legs, they can just turn their foot out and reach one foot into the foot holder. The other way is they pull themselves up, they turn their foot out, always lead with the heel to get in and out of the foot holder, and then they can lie onto their back. So we're gonna do a hamstring curl, and basically he's gonna bend his knees and come up and come back down. And there's a challenge here because there's a point where you might wanna increase the resistance. However, oftentimes I see my patients really arch their back and they lose that spinal stabilization. So to help increase the resistance, what I can do is just bring one knee into their chest, and that helps with stabilization. And I'll reiterate that as well. If, for instance, they need to come down an incline, I can always lower them. Or if I'm working with a unit that I would have to transition the person off the machine and get them back onto the machine, an easy, simple way is to have the person self-spot, and that will decrease the amount of resistance. So in this case, he just puts his foot right on top, and now he can self-spot. So we're going to transition a little bit in that thought of in this position to strength and move a little bit into the awareness section, because I might be doing the same thing but my intention is different. For instance, maybe he has his foot here to self-spot and make the resistance less. I might also bring his foot here because maybe he needs to have a little bit more stabilization in the back. So I can either have his knee into his chest, which requires greater strength requirements, and that helps stabilize in his spine, and or I can bring this leg all the way out, bring it here, and maybe just that little bit amount of having the leg come up allows for the pelvis to stay a little bit more stable and the spine to stay neutral. So the element of mobility will also go into where the most important factor is how much range of motion they have and pulling up. So Jeff here got on the board pretty readily, and he positioned himself right at the top edge of the glide board. Oftentimes when our patients first get down onto the machine, they'll position themselves further down on the board, and when they go to do the hamstring curl, it's called topping out. They'll top that's exactly what you'll hear. You'll hear the board come to the top, and they don't necessarily feel like they're getting a good range of motion. So when you cue someone to get on the machine, you might have them scoot up a little bit. Now with that said, if they have an injury or anything like that where you're trying to limit the range of motion, then it might be what you might exactly do is bring them to the bottom. And outside of the strength, mobility, and awareness section, I do want to bring up one factor, is this: you are inverted. And for some people, that is very uncomfortable for them. They might have glaucoma, blood pressure issues, acid reflux, whatever it may be, that doesn't allow for them to feel comfortable in an inverted position. But you want to be doing hamstring work. So option one is they can prop themselves up onto their forearms, and if they don't have the strength there, maybe they can sit all the way up. This does require a lot more core stabilization. What I've also been doing with my patients is I'm going to have you position your feet out of the foot holder. So he's going to take his feet to turn out, and he's going to come out. The other thing I've been doing is just bringing the board up a little bit to an incline. And now they can lie back, be supported, and they can move through the hamstring movement in a manner that feels effective and safe for them.